Hi, Miss Drinkwine. My name is Aurore Dorsinville. I'm your student physical therapist for the day. How are you?
I'm good. How are you?
Good, thank you. So first off, let's just verify your name.
Helga Drinkwine.
Helga Drinkwine. Good. And your birthday. Good. Oh, sorry. Your age.
I'm 24.
24. All right. And I see you've been referred by your doctor for a left hamstring strain. Is that correct?
Yes.
Okay. All right. And have you been to physical therapy before?
No, I've never been to physical therapy before. I'm a little nervous about it. One of my friends had a really bad experience.
Oh, okay.
He just said it was really painful and didn't really help him, and so I'm just really worried that my leg is not ready.
Okay, I apologize about your friend. So I see here, you were scheduled to come 2 weeks ago. Can you tell me about that?
Yeah, my doctor told me to go ahead and make an appointment, but when the day came around, I was in a lot of pain, and I just didn't really think I could have done much while I was here, so I just pushed it back a couple weeks.
I apologize about that. And sorry about your friend again. I don't understand why he was so in pain in the facility that he went to for physical therapy.
Mm-hmm.
But I can assure you, here in this facility, the point is not to send you home in pain. Okay, we're trying to make you feel better. Okay, so if there's a exercise that I show you that you're doing and that makes you feel uncomfortable or it's a little intense, just let me know and I will modify to your comfort level. Is that okay?
Yeah, that makes me feel a lot better.
Okay. And that's the point. We're trying to make you feel better.
Good.
All right. So first off, just a brief description of what we're going to be doing. So right now, I'm just getting to know you. And then the next part will be the objective part where I'm going to be taking your measurement and probably do a couple of tests on you.
Okay.
All right. And sorry if you see my head down. I'm just taking down some notes.
That's okay.
All right. So what do you do for a living?
I'm a dancer at SeaWorld.
No way, really?
Yeah.
Yes?
It's really fun. I started about 2 years ago, so I do some of the backup dances and routines. I have a character.
Oh, who is it?
It's Punky the Chipmunk.
Oh, wow.
So I started about 2 years ago. I actually just got promoted to being the trainer for the new dancers.
Oh,
so
that's
I'm really
exciting.
excited.
Okay. So typically, what's a day like as the chipmunk?
Well, we go in and we usually rehearse for a little bit in the morning before the park opens, and then we perform the performances are usually 30 minutes, and then we get a little break, but then it's pretty much on and off all day. So I'm running around a lot and jumping and dancing, so it's very active.
Okay, that's good. So typically, how many hours do you work for the week?
About 40 hours a week.
40 hours a week, and you say a lot of moving around, jumping.
Yeah, it's very active.
Very active. Okay. And have you been working since the accident or injury?
Not really. I can't do very much of the routines and the dances and stuff. But since I did get that promotion, I've been going in and trying to kind of just prepare for that, because I don't want them to pass it on to somebody else just because I'm hurt. So.
Yes. I can see the frustration. I can understand the frustration as well. I mean, it's a hurdle right now, so we're going to work together to get you as close to 100% as possible. And that promotion is a big deal, okay? Let's try to give you that promotion, okay?
Yeah, absolutely.
All right. Okay. All right, so are you involved in the community?
No, not so much. My work keeps me pretty busy.
Okay. All right, so can you just describe your home layout for me, please?
Sure. I live in a 2-bedroom house, me and my dog, Cookie, and I live by myself right now. So I have one flight of stairs that I've just mostly been trying to avoid ever since I got hurt, because I just don't want to do anything that makes it hurt more.
Okay, so the flight of stairs, it's to lead to your bedroom?
Yeah, my bedroom's upstairs. I've for the most part, I've just been sleeping downstairs on the couch since I got hurt, just because using the crutches, I've gone up and down a couple of times, but it's just awkward and hard to get up and down.
Okay, so the crutches, you've been using the crutches since, how long has it been?
Since I saw the doctor, which was 4 weeks ago.
Have you seen him again? Did he examine?
No, I haven't been back. I kind of just assumed that I would keep using the crutches until I started feeling better.
Okay, understood. So when we move on to the objective part, when we do the tests and measures, I just want to see how you're fitted for the crutch. Okay, is that okay with you?
Yeah, that would be awesome. Sometimes I feel like I'm not using them right, so I want to make sure that I'm not doing anything that's going to make my leg worse.
Okay, understood. Okay. Okay. And do you have any hobbies?
I like to hang out with my friends. We usually we'll go to a happy hour once a week or something and have some martinis. Yeah, but not any wine. I know, my name's Helga Drink Wine and I don't like wine. Everybody thinks it's crazy, but yeah, I just like to have a couple cocktails.
Cocktails? And how many drinks do you typically drink during the week?
Normally I only really drink when I'm out,
Okay.
and so I would say 2 or 3 whenever we go out to a happy hour. Yeah.
Okay. All right. So, and then just to make sure, you said that you currently not working. You just go in just to supervise things, correct?
Yeah, most of the time I can't do much.
Okay. And for exercise, what do you do to exercise?
Well, before I was running pretty consistently. About a year ago, I really wanted to lose some weight, and so I started a running program, and I've been doing really well with it for about the past 8 months. I've been running really consistently, but I obviously can't do that now, so I'm kind of worried that it's going to be really hard to get started again. I don't know, I don't want to go back to being inactive just because of this injury.
I understand, and I commend you for even starting to exercise. It takes a lot for someone to start exercising, and you did it for eight months. And I understand that that hamstring strain, it's a hurdle right now. We're gonna surpass it together, and then get you back to that routine. Your routine might even get better. Okay?
I hope so.
Yeah, it will definitely. Okay. All right. So just show me where it's hurting.
Okay, yeah, so it's all on the back of my leg here, just right down the middle of the hamstring.
Okay, do you mind if I examine?
That's okay.
Okay, good. So you said in the back of your hamstring right there. And do you feel any pain up to your buttocks?
No.
No? What about down your leg?
Mm-mm.
No? What about the knee?
No, the knee's fine.
And the ankle?
It's okay.
Good. What about your lower back?
Sometimes it hurts a little bit after using the crutches all day, but it's not really enough to be super bothersome.
Okay. And what about the other leg? Do you feel anything over there?
No pain.
No? The whole leg, nothing on the other leg?
Mm-mm.
No? What about your torso? Do you feel anything there?
No, it's okay.
No? Okay. And can you just describe the pain for me, please?
Yeah, it's a deep, sharp pain.
Deep, sharp pain? Okay. Okay. So you don't feel anything on top of your skin? Do you feel anything there?
Not really. I just feel it's really deep in there in the muscle.
And numbness and tingling sensation anywhere?
No.
No? Okay, just to verify, I just drew this right here. Does that describe where your pain is?
Yeah, that's right.
Okay. Right. So I'm just gonna give you a scale. 0, no pain, and then 10, you absolutely have to see the emergency room right now. Can you rate your pain for me, please?
Right now, just sitting here, probably a 1.
And what about at its best?
It gets down to a 0.
Oh, that's good. So you don't feel pain sometimes, right?
Yeah, sometimes.
Okay. And what about at its worst?
Probably a
A
6.
6. Okay. And how do the pain make you feel?
It's just really frustrating, especially just getting this promotion at work. I feel now having to deal with this injury is just a lot of extra stress, and I just want to be able to get back to working fully and doing just normal daily things. It's just hard.
Yeah. It's a natural way to feel, and I can understand if that is even building even more anxiety. It's understandable. So now it's just managing that, right? And you didn't come 2 weeks ago, or you're here now, right? And that's a big step, all right? So now it's just us moving forward, us getting back to in shape, and keep that promotion and get back to exercise, okay?
Okay, great.
All right. All right, and all right. So next, what brings on your pain? What activities do you do brings on the pain?
Any sort of dancing, things I would have had to do in the routines, that makes it hurt. And then also just walking. If I am walking for more than a minute or two, it starts to hurt and then kind of gets progressively worse the longer I walk.
Okay. And how long does it take for it to come on?
Usually a couple of minutes, and then it gets worse.
And that's for both activities?
Yeah. Yeah.
Okay. And what do you do to make the pain go away?
Well, when I went to the doctor, they told me to rest and elevate and all that type of stuff. So I usually just try to take my weight off it. If I can, I'll lay down and prop it up with some pillows. And then icing it helps too. And I've also been taking a muscle relaxer, so that helps it calm down a little bit too.
And what's the name of the muscle relaxer?
Oh, it's something with an M, Mobic.
Oh, yeah, that sounds familiar. And how often do you take that?
Once in the morning and once at night.
Okay. And how long does it take for the pain to go away?
Usually, if I'm able to lay down like that, in 5 minutes or so.
And in the morning, how does your pain feel?
In the morning, it's fine. I usually don't have any pain.
Is that when you have your 0 out of 10 pain?
Mm-hmm.
And what about throughout the day?
Throughout the day, I'm moving around more, and so it starts getting worse. And then, like, as the day goes on, I feel like longer into the afternoon is when it is the worst.
Worse, so moving around just aggravates it?
Yeah.
Okay. And what about at night?
At night, it's painful since I've been, like I said, active all day. But, like, once I can lay down and do those, like, icing and things like that, it starts feeling better. So I'm usually able to go to sleep fine, and it doesn't bother me too much.
All right. And is there anything that I missed that you want to tell me additionally that brings on your pain or anything like that?
No, I don't think so.
Okay.
Covered it.
Okay. And moving on to the medical history screening form, thank you for filling that out. I know it's a headache to come early, but this is the only time you're going to be coming early to fill out a form, okay? And the next series of questions, it might feel a little bit uncomfortable, but I do have to ask them. Do you have any issues using the restroom?
No.
No? Or any pain, sneezing and coughing?
No.
And have you experienced any night pain since the injury?
A couple times it's woken me up in the night, like if I roll over and I'm like, oh, ow, like, but as soon as I get comfortable again, I can go right back to sleep.
Okay. All right. And have you had any imaging done?
Yeah, when I went to the doctor, they did an X-ray and an MRI.
Okay.
And it showed a grade 2, I think they said, strain in my hamstring.
And you mentioned before you take the Mobic about 2 times a day, and then you take any medication for anxiety as well?
Yes. I've been on anti-anxiety medication for about a year.
About a year? And how's that going?
It helps. I can definitely, like, with this injury, like, feel my anxiety getting worse. So I've been making sure to take it consistently because I don't want it to interfere with my day.
Understood. So you've been taking it consistently, like you mentioned, correct?
Yes, yeah.
Okay. So I might send you home with a couple of exercises to do at home. So how do you learn best?
I usually just learn, like, if you could show me first, that would help me. I like seeing it visually. And then that way you can kind of, like, watch me do it, make sure I'm doing it right. And then if you could just give me a little, like, reminder form or handout or something to take home, that'd be great.
Okay, good. So no issues with hearing or seeing things? No?
No.
Okay. All right. So I see from your intake form you had surgical hip labral repair, correct?
I did.
Can you just elaborate on that for me, please?
Sure. It was a few years ago. I injured myself cheerleading at a competition. And yeah, they did the surgery, and I don't really have any, like, leftover pain from it. I'd like to not have to have surgery again. That was not a fun experience. But, as far as the hip goes, it doesn't normally bother me.
Okay. So it's not bothering you anymore, right?
No, it'll get sore every once in a great while, but nothing consistent.
Okay. So tell me, what happened to your hamstring? How did you get hurt?
Well, I was trying to hang a flower pot, and I was in my front yard, and then I needed to reach up higher, and I was dumb, and I should have went and got a step stool, but I just climbed on top of this other pot that I had, and it tipped over, and Cookie was right there underneath me, and so I was trying to not land on her, so I just kind of straightened my leg out really weird and landed on it funny, and it just really yanked on my hamstring.
Okay, so the hamstring. All right, so it happened when?
It was 4 weeks ago.
And how's the pain? Has it gotten worse or better or the same?
It's about the same.
About the same? Okay. All right, so what do you want to accomplish out of physical therapy?
I really just want to be able to get back to work. I want to be pain-free, and I want to be able to do all of my normal activities.
Okay, so we work together to get you as close as possible to getting back to normal things. Okay.
Perfect.
So we're gonna move on to objective part. Are you ready?
I'm ready.
All right.